Welcome back, it's Dr. Somji. Today we're going to be talking about treatments for older skin. So patients in their 60s, 70s and 80s. Yes, I see patients in my clinics in their mid-80s that still want to maintain their skin. And I'm going to go through some of the non-surgical treatments that you can do with lower risk profile that can rejuvenate your skin and make you feel better about yourself. So, before we talk about which treatments are appropriate, it's really important to understand the aging process. So we know in various aging studies that there's different changes that happen in the layers of the face and the neck. So as we get older, in the outer layers, the skin, we lose collagen and elastin. This results in fine lines, wrinkles, as well as gathering things like sun damage over the years. So you may get more pigmentation. You can also get different solar induced lesions on the skin, which can give an uneven appearance of the surface of the skin. So we know we lose collagen, we know we lose elasticity within the skin, so that outer layer doesn't look as smooth. Then underneath that, within the fat layer, we get some shrinkage of fat within different compartments. That also contributes to the sagging that happens within the face. So you get kind of jowls within different areas. The overall face changes from that nice triangular shape to a little bit more squarer and heavier at the bottom. Unfortunately, with gravity, everything comes down. Then we also know that that muscle layer, in clinical studies, people used to say that this muscle layer used to become a little bit weaker, but we know it remains relatively unchanged over time. It's those changes that are happening above that really cause those signs of aging that we see as you enter your 60s, 70s, as well as 80s. But the key concept that we really need to understand, and where a lot of our treatment is focused, is bone loss. We know the skull changes over decades. So even as early as probably even mid-30s, we're starting to see loss of volume in certain areas within the skull. We start seeing hollowing within the temple region. This results in the brow coming down slowly. And also we see widening of orbital bone, and that results in more puffiness that we see around the eye area. We also see loss of volume in the mandible, which results in less of an angular jaw and more of a blunted angle, and actually contributes to the drop and those jowls that we see. And most importantly, we see loss of volume, more retrusion, so the chin going backwards and slowly tipping upwards. So you start seeing that process where the chin's coming up and back and the jowl is starting to happen. These are the things that we see. So when we're looking at non-surgically, we need to understand that we need to replace that loss of volume within the bone compartment, and this results in volumizing the temple area to increase the volume in the temple to provide a little bit of support. You can do that with fat transfer. That's a great way to volumize the temple area. You can also do it with part collagen stimulators and part fillers, things like Radiesse as well as Sculptra, as well as traditional hyaluronic acid can be injected in this area just to replace a little bit of volume. It's a procedure that can be done in the temple quite quickly. You can also do the same in the angle of the jaw to help not only with the volume, but also a little bit of collagen and elastin stimulation as well. And more importantly, in the chin area, we want to add that volume so that it provides the support for these structures that we see over here in the jowl area. A lot of people used to say to put volume in the cheek, but we know that those fat pads only shrink slightly over time. And in fact, the bone doesn't really change so much in this area, which we've seen in recent studies. So we don't really want to fill this area too much because it looks too puffy as well as pillowy. So as you can see, using just volumization as well as a little bit of skin tightening alone in this picture, you can see an improvement in the jowl area that we were able to do non-surgically. So for the next layer, for the fat layer, you can shrink and tighten that fat layer. We know that certain areas of fat essentially descend through the face, particularly in the lower part of the face. So once you replace that volume, you almost want to kind of remove some of that fat within that area. And you can do this whilst tightening the skin A procedure that I do a lot of in the clinic is called Facetite. And as you can see in this patient, I've been able to debulk this lower part of the face so that it gives her a better contour and less weight in the lower part. So less square, more triangular, which is the triangle of youth that I always talk about. You want it to sit like this perfectly rather than like this. And you can then use the radio frequency to tighten the skin over the top. So you can use it in specific areas of the face. It's relatively non-invasive. It's still like soft surgery with like a week's worth of downtime, but it's extremely worth it for a patient because you're gonna add the volume and you also need to reduce some volume within certain areas. It's what we call debulking. Now, the exciting bit that a lot of people do that's really non-invasive is to treat the skin, because the skin is what we see. We talked about loss of collagen, loss of elasticity. It's really important when you're looking at collagen stimulating treatments from your 60s that we look at the quality of the skin first, because traditional treatments like collagen stimulation treatments, things like microneedling, things like laser, all of these treatments that you know and love, they may not work as well as you get older because your body's healing responses are completely different. So what we try and do is do a nice Visia analysis to look at the quality of the skin, look to see what the skin thickness is, and see if we need to pre-treat the skin before you use collagen stimulation treatments. And what do I mean by that? Well, what if we can put more collagen or stimulate your own collagen just with injectables within the skin? This is where things like Sculptra, Radiesse, as well as things like polynucleotides come into play because they set the scene. They stimulate your body to produce more collagen and elastin, thicken that area up, and it means the skin is more healthy when you're doing energy-based treatments. Things like CO2 laser, things like radiofrequency microneedling are really, really important. So you want to pre-treat the skin. You may not need to do that for younger patients, but definitely for older patients, you need to do that. So what I do is I prime the skin with collagen stimulants beforehand, and even in that priming stage, you're getting a benefit. So you see some results in terms of before and afters with things like Sculptra. You see that change, and it stimulates collagen for even up to about 2 or 3 years after the injections that happen. So when someone comes to see me, I say to them, look, you're in your 6th, 7th, 8th decade, we need to replace the collagen that you've lost. And that equates to maybe 1 vial of Sculptra for every decade. And we need to do that within an 18 to 24 month period. Once we're done, then we can get started with smoothing out the fine lines as well as helping things like pigmentation and tightening the skin. As you can see with this patient, she's had an aggressive CO2 laser, which is fully ablative. That means that she's got downtime of even more than 4 or 5 weeks. You don't need to be so aggressive, but a lot of patients see me from abroad and they want that one and done treatment. You can see that you can get amazing results just in terms of the skin tightening as well as shrinking. You've got another patient here who decided to go for a little bit more of a milder treatment basis, and that can also be part of your strategy. You don't have to go aggressively. She's still got great results just from non-surgical treatment, and she had a mixture of radiofrequency microneedling with the Morpheus as well as a little bit of fractional resurfacing as well to help clear up the skin. Now, what do you do with skincare? Well, in older skin, it's really important to include retinols at higher strength. You don't need to go in so hard. You can use an encapsulated retinol. This is the reason why I designed the Dr.Somji skin with encapsulated retinol, so you can get benefits from that retinol in terms of stimulating collagen, maintaining the skin texture, as well as reducing fine lines and also things like pigmentation as well. You also want to include things like vitamin C, which are great antioxidant for the skin to prevent further damage from taking place as well. And the most important thing is your SPF, which is your sun protection, ensuring that you are reducing the chances of things like precancerous lesions over time, but again, also protecting your skin to ensure all of those benefits that you've got from those treatments are not wasted. In summary, we've talked about some non-invasive treatments that you can have done from your 60s all the way through to 80s, possibly 90s, or even a century old for patients that you can look at that are minimally invasive but make a profound change. If you have any questions, just let me know in the comments below. If you want me to talk about any other decade of life and which treatments you should be having, just let me know in the comments below. Don't forget to click the link to like as well as subscribe to the channel, because we've always got new content coming out and you'll be the first to know.